Good afternoon. So I'll be presenting evaluation of role of oral vitamin B12 and folate supplementation in open angle glaucoma. I have no financial disclosures. So glaucoma, as we all know, is defined as progressive optic neuropathy, and according to ICD-10, vision loss is seen in around 57.5 million individuals worldwide. So the obvious research question for me was, what are the non-IOP dependent factors in glaucoma progression, and is there any role of neuroprotective vitamins like B12 and folate in glaucoma progression? So the purpose of my study was to analyze the role of oral supplementation of vitamin B12 and folate in open angle glaucoma. It was a prospective longitudinal randomized intervention trial with a study duration of 6 months, sample size of 144 patients. Study group being divided into two, intervention and the control group, where the intervention received the normal anti-glaucoma medications with oral vitamin B12 1000 micrograms once a day and oral folate supplementation 5 mg once a day, and the control group only received the anti-glaucoma medications. The inclusion criteria was patients aged between 40 to 70 years diagnosed with open angle glaucoma, which included mild, moderate and advanced glaucoma of primary open angle glaucoma, normal tension glaucoma and pseudoexfoliative glaucoma on medical management. The data collection parameters included serum vitamin B12 levels at presentation and follow-up, serum folate levels, best corrected visual acuity, intraocular pressure by Goldman applanation tonometry, Humphreys visual field analysis of 24-2C, and optical coherence tomography assisted retinal nerve fiber layer and ganglion cell analysis. So coming on to the results, on the demographic data, as we can see, the maximum patients belong to the 60 to 69 years of age group, with a slight male preponderance in both intervention and the control group. And majority of the patients in the study group were vegetarian by dietary preferences. Coming on to the distribution of the diagnosis, maximum patients belong to the group of primary open angle glaucoma, and on severity scale, maximum belong to the group of mild severity in glaucoma. Coming on to the retinal nerve fiber layer analysis, as we can see, there is a loss of retinal nerve fiber layer in both intervention and the control group. However, the rate of loss of retinal nerve fiber layer is more in the control group as compared to the intervention group. Similar results were seen in ganglion cell analysis, where the rate of loss of ganglion cell layer was more in the control group as compared to the intervention group. The change in serum levels was as predicted, showed a rise in serum levels of B12 and folate in the intervention group. So coming on to the discussion, so the overall change in retinal nerve fiber layer over in time, because between the two groups follow-up showed more retinal nerve fiber loss in the control group. So there were multiple studies where I tried to study, is there any relevance of giving B12 supplementation? So I could find various studies that have shown that low serum vitamin B12 levels have shown lower retinal nerve fiber layer thickness in patients. However, there was no study that could see the effect of oral supplementation of these vitamins over progressive groups. Coming on to the ganglion cell analysis, the intergroup analysis between the group did show significant change in ganglion cell analysis at baseline and follow-up. In our study, the change in ganglion cell analysis in the intervention group was 1.74 microns over a period of 6 months, and in control group it was 2.24 microns over a period of 6 months. And there was no study in literature that could tell us the association between the serum levels of vitamin B12 and the ganglion cell layer thickness. So yes, we agree our study had a few caveats. So there was no long-term data available as to what is the safer duration of supplementation of these oral vitamins, and it was limited to the evaluation of vitamin B12 and folate. However, there are studies indicating the role of other vitamins in disease progression. The limitation being a short-term period of study with a smaller number of patients to reflect the effectiveness of supplementation in preventing the functional loss in glaucoma. So just to conclude, oral supplementation of neuroprotective vitamins can be helpful as an adjuvant along with the conventional anti-glaucoma medications in treatment of glaucoma. It might help us answer why patients who have actually achieved target IOP still show glaucoma progression, thereby indicating presence of non-IOP dependent factors. And long-term follow-up with oral supplementation of vitamin B12 and folate along with anti-glaucoma medications may stagger the structural loss in retinal nerve fiber layer and ganglion cell analysis and functional loss on visual field analysis. Thank you.
Thank you.
You have done, you have given the B12 and folate simultaneously.
Yes, ma'am. 1000 micrograms of vitamin B12 and 5 mg of folate once a day.
Because this vitamin B12, it acts by homocysteine.
Yes, ma'am.
And it produces apoptosis and kills the retinal cells if it is increased.
Ma'am, vitamin B12 is a water-soluble vitamin, so
yes,
there are very less reports. In fact, I could not find a report of vitamin B12 toxicity that is happening in patients.
Actually, it depends on the doses duration of the drug,
Yes.
and if it is both are acting differently. Folates are neuroprotective
Yes, ma'am.
in the full dose,
Yes, ma'am.
while the B12, if we are giving more, it causes the disastrous results.
Ma'am, the reason why we were not giving treatment dose, we were giving prophylactic dose, and the reason the study stopped at 6 months because we could not find any long-term data to tell as to what is the ideal duration of giving these vitamins.
So actually this is non-specific.
Yes, ma'am. Ma'am, it was a new idea, a new concept, so we had to take maximum measures that we could control, and we had to, yes, give up on a few measures that were out of our control.
Did you find any increase in thickness of RNFL and GCC or
No,
just the
sir.
control?
No, sir. No,
Just
sir.
the
No
control.
increase in thickness in RNFL. Yes,
You
sir.
just detected no decrease in the thickness.
Yes, sir. We did document decrease, but the rate of decrease was more in the control group as compared to the intervention group, sir.
And results will be
Why do
different.
you expect a decrease in control group?
Sir, both
Because
the,
control group are non-glucomatous.
no, sir. The control group was glaucomatous. They were on medical management with
Okay.
standard anti-glaucoma
Okay, got it,
medications.
got it.
The only difference was the control group was not given oral medications, and the intervention group was given medications.
So,
Any variation in the this closed angle, open angle?
Ma'am, could be. The reason why, because the pathogenesis of both open angle and closed angle differs. Closed angle can cause sudden decrease in retinal nerve fiber and GCL answers. The reason why we did not take it in the study, because the pathogenesis is different, it is difficult to compare both the mechanisms together in a single study.
Because folates are more beneficial in open angle.
Yes, ma'am. Ma'am, we could predict the probability progression of an open angle glaucoma. The reason why we prefer taking an open angle glaucoma as compared to angle closure, ma'am.
do you think you should have done the serum levels of these before starting the
Yes, ma'am, we
study?
did. Patients who did have hypervitaminosis of B12 or folate were excluded from the study. Patients with normal or lower level, normal was included, that too after informing them that this is this layer levels. Yes, ma'am.
Okay, thank you.